Welcome back, everyone. Today, we are starting a topic that many students find confusing and honestly a little scary: schizophrenia. But don't worry, by the end of this video, you will understand it clearly, simply, and without fear. So, let's begin from the very basics. Schizophrenia is a mental disorder in which a person loses touch with reality, not suddenly but gradually. Severe means it affects daily life. Mental disorder means it affects the mind, not intelligence. But what exactly changes in the person? Let's understand that slowly. In schizophrenia, four important areas are affected: how a person thinks, how they understand reality, how they express emotions, and how they interact socially. Let's break this down one by one with examples you will remember in exams. Thinking means how we organize ideas and make sense of things. In schizophrenia, thinking becomes disorganized. For example, a patient starts talking about breakfast, suddenly shifts to the government, then to God, with no clear connection. And when thinking becomes unclear, perception also changes. Perception is how we see, hear, and understand the world. In schizophrenia, perception can become distorted. The person may hear voices or see things others cannot. For example, hearing someone calling their name when no one is there. And this affects emotions too. Normally, emotions match situations, but in schizophrenia, emotional responses may be reduced or inappropriate. For example, a patient may show no reaction to sad news or laugh at serious moments, and slowly this affects relationships. Many patients slowly withdraw from others. They avoid family, stop conversations, and prefer isolation. This is not rudeness, it is part of the illness. All of this leads to one key concept: loss of contact with reality. When thinking, perception, emotions, and social behavior change together, the person begins to lose contact with reality. They may believe things that are not true and fully trust those beliefs. And this is where many myths begin. What schizophrenia is not. Let's be very clear. Schizophrenia does not mean having two personalities. It is not mental retardation. Mental retardation means intellectual disability which affects intelligence from childhood. But a person with schizophrenia may have normal intelligence. It is not caused by laziness, lack of faith, or poor moral strength. Even hardworking, educated people can develop schizophrenia. It is caused by brain and neurochemical disturbances and needs medical treatment. Patients improve with antipsychotic medications and therapy. The diagnosis of schizophrenia requires symptoms for at least 6 months because it is a chronic illness, meaning it is long term and persistent. Short term symptoms are classified differently. If psychotic symptoms appear for a short duration, like a few days or weeks, they are called acute psychotic episodes, not schizophrenia. For example, psychotic symptoms after severe stress that resolve within 1 month. Schizophrenia requires long-term symptom presence. Schizophrenia often follows a chronic course with periods of improvement and periods of relapse. This is why continuous treatment and nursing follow-up are essential. And this is where the nurse plays a vital role. Understanding schizophrenia is very important for nurses. It helps us communicate calmly, respond with empathy, and reduce fear and stigma. When nurses understand the illness, they can support treatment, ensure medication adherence, and build trust with patients and families. Now that we understand what schizophrenia is, the next important question is, why does it occur? In the next video, we will discuss the causes of schizophrenia using the biopsychosocial model. If this video helped you to understand schizophrenia a little better, please like, share and subscribe. We will continue with the causes in the next video.